tennis elbow,
I think doesn't have any problems with that.
extensor tendinopathy. Now, oftentimes where the tendon is irritated is right at the attachment of the bone. That's called the enthesis. So that's also called an enthesopathy. Enthesopathy. That's at the attachment to the bone where this is a factor. Tennis elbow, wrist extensors. And so this is the most common problem of all elbow problems. It's the most common problem. And because of that, named tests were designed first for this condition. And that's what you need to remember. So as we go through this process, under here we're going to have Cosen's and Mills tests. Okay, let's get started. Okay, before we get to that, let's just do one more thing here, just to remember from what I just said. We have pronator teres. Remember that? Pronator teres has two bellies. 1, 2. And between the two is the median nerve. And there's a branch that branches somewhere around here, so where it branches makes a difference. And this is the anterior interosseous nerve. And either or both of those can be entrapped with the pronator teres syndrome. So the first test we're going to do is simply the Valgus and Varus stress test. And by far the most significant is Valgus. Varus, strains and instability can occur, but it's really much less common than Valgus instability and sprains. I said strains, I meant sprains here. In fact, I think we talked earlier about the Tommy John surgery. That's about repairing the medial collateral ligament of the elbow, and we can talk about why that's the case. The elbow is meant to be a very tight hinge, and when it's not a tight hinge, exactly, you're doing the exact wrong thing right there when you throw. So what are we going to do here? Well, with the elbow fully straight, we're going to test valgus stress and varus stress, looking for pain, and also looking to see, does it stop? Is there an end field, or is it an empty end field? And the bottom line is this: if you see it go, whoa, and it might not even be painful. It doesn't make a noise, but it feels like it should make a noise. That might be ruptured. And you always have to keep that in mind. And you test it if it is or isn't painful. And if you can stand up so people can see well. So I simply place my hand on the lateral aspect of the elbow. I test it in full extension. Ask, does that hurt? No. Good. I tested 30 degrees flexion. Does that hurt? No. And you can also test it at a whole bunch of different stresses, and it's good to do that. Okay, but the standard is full extension and 30 degrees. Do the exact same thing with the varus stress test. So right here. Right there. Same exact thing for a varus stress test. Again, a much less common condition. Full extension, less stress on the ligaments, 30 degrees of flexion, and more degrees of flexion as well. Pretty straightforward, right? Let's quickly get into pairs and practices, and then we'll go through our